Colon cancer usually begins as small clumps of cells called polyps that form inside the part of the large intestine called the colon. Polyps are generally not cancerous, but some can turn into colon cancers over time. If this colon cancer is left undetected or untreated, it can work its way through a layer of tissue, muscle, and the outer layer of the colon. The colon cancer may also spread to other parts of your body via your lymph nodes or your blood vessels. And unfortunately, it is estimated to be the second most fatal and the third most commonly diagnosed type of cancer. The early detection and diagnosis of this kind of cancer may prove to be a lifesaver. So, how can you tell if you have colon cancer, and how can you detect it early? In this video, let's learn about some critical colon cancer symptoms that you should not ignore. Colon cancer symptoms are basically of two general varieties: local symptoms, which are based on where the tumor is located, and systemic symptoms, which involve the whole body. First of all, let's see what are the local symptoms. Number 1. Changes in bowel habits. According to studies, almost 2/3 of people with colon cancer experience changes to their bowel movements. This may happen because the cancer can block or narrow the passage in the colon, making it harder for stool to pass through. As a result, patients might experience different patterns in their bowel habits and often blood in their stool. When it comes to bowel habits, there's no one-size-fits-all definition of a normal bathroom routine for everyone. Everyone's bowel habits are different, and what's normal for one person might not be the same for someone else. The size, color, and consistency of everyone's stools are unique. Therefore, it is important to notice any change in your normal bowel habits. For example, a persistent change in stool frequency can be a potential sign of colon cancer. For example, if it is normal for you to have 3 bowel movements per day, and you are having only 1 per day or 1 every other day, this may signal constipation. Second, abnormal changes in stool shape. If your poop looks thin, like a ribbon or pencil, it might be a sign of colon cancer. In a healthy person, narrow stools can happen when the colon gets narrow, caused by colon cancer. If you notice this, it's essential to talk to a doctor about it. Third, abnormal changes in stool color. When colon cancer starts causing internal bleeding, it can show up as either bright red or dark red blood in your poop. If the bleeding happens at the beginning of your colon, which is on the right side of your tummy, the blood might make your poop look maroon or purple. But if the tumor is in the lower part of your colon, the bleeding will likely make your poop bright red. Seeing blood in your stool, no matter the color, means it's serious, and you must talk to a doctor. It could be one of the first signs of colon cancer, and getting checked out is really important. Fourth, difficulty in passing stools. If you keep feeling like you need to go to the bathroom even after you've just been, then it could be a sign of colon cancer. This feeling may arise because of the blockage or obstruction in the colon caused by a tumor. Even after you've emptied your bowels, the presence of the tumor or the constriction it causes might give you the persistent sensation that there's still more to pass. This sensation can be due to the nerve endings in the bowel being stimulated by the tumor or the narrowing of the passageway. But remember that this can also happen in other conditions, such as inflammatory bowel diseases or certain gut infections. So you must consult a healthcare professional for further evaluation, especially when it's persistent or shows up with other symptoms of colon cancer. Fifth, alternating constipation and diarrhea. Symptoms of alternating diarrhea and constipation may occur when there is a partial obstruction in the bowel due to a tumor. This can happen because the tumor makes it hard for stool to pass through, causing constipation. When the backed up stuff finally gets through, it can lead to diarrhea. So it's like a seesaw between trouble getting things out and then a sudden rush. If you're experiencing these ups and downs, it's a good idea to talk to your doctor. Number 2, abdominal pain. You know, if you're feeling some cramps or pain in your belly, it could be more than just a regular ache. Research has shown that having abdominal pain is linked to a 34% higher chance of getting colorectal cancer early on. This kind of pain was found in about 11.6% of people diagnosed with colorectal cancer within 3 months to 2 years. In comparison, only 7.7% of those without cancer had similar pain. Pain associated with colon cancer usually happens in the belly, but it can be a bit tricky to pin down exactly where. Most people describe it as a dull cramping sensation, and if you are a woman, you might mistake it for regular menstrual symptoms. But it's crucial to pay attention and not brush it off, especially if it's hanging around or showing up quite often. Number 3. Gas and bloating. Excessive gas and bloating might seem like routine tummy troubles, but they sometimes signal something more serious, like colon cancer. Usually these symptoms may be triggered by what you eat, like fizzy drinks, dairy, or high-fiber foods, and even certain digestive problems like inflammatory bowel disease. But when gas and bloating persist or become bothersome, they might be linked to colon cancer and usually appear as late signs, often when the tumor starts blocking the colon. So while gas and bloating can be due to everyday causes, it's important to be aware of these symptoms, especially if they become too frequent or too severe. Number 4. Nausea and vomiting. To be honest, nausea and vomiting alone don't always indicate colon cancer. But don't ignore them, particularly when they are accompanied by other worrisome signs, such as constipation, abdominal cramping, and others. Now let's learn about the systemic symptoms of colon cancer, ones that can affect your whole body. Number 5. Unintentional weight loss. It can happen when the tumors start utilizing our body's resources, like oxygen and nutrients, to grow and spread. Sometimes, tumors release certain chemicals that may increase the body's metabolism. Both these factors can contribute to unintentional weight loss. If you are losing 10 pounds or more, or at least 5% of your body weight over a period of 6 to 12 months, then it may be because of cancer or any other complication that's messing with your metabolism. For example, if you weigh 150 pounds and are losing 7.5 pounds within a year without even trying, then you must consult with a healthcare provider. Number 6. Unexplained fatigue. Feeling extremely tired might not seem like a big deal, but it's quite common in people dealing with more advanced stages of cancer like stage 4 colon cancer. This kind of fatigue is different from regular tiredness. It doesn't usually go away after resting or sipping a strong cup of coffee. So if you are feeling unusually tired, and too often, then it's a good idea to schedule a chat with your healthcare provider. Colon cancer caught in its early stages is highly treatable. Regular screening tests are recommended for everyone starting at age 50 or earlier if you have risk factors. But do remember that these are just potential signs, and not everyone with colon cancer will experience them. Many of these symptoms can be caused by other conditions as well. Seeing a doctor promptly is crucial if you experience any of these symptoms, especially if they are new, persistent, or get worse with time. Early detection can significantly improve your chances of a successful treatment. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.